Welcome to Centered Presents The Future of Health. Join me, Christina Walecka, along with Dr. Molly Brown, as we dive deep into the world of brain-based wellness.
In each episode, we will explore cutting-edge insights and practical techniques that empower you to achieve optimal health and super high-energy living.
Tune in and start your journey toward a healthier, more vibrant you.
Welcome to our podcast. Centered Presents The Future of Health explores solution and results-based care. Our first podcast is on pain. It is estimated that over 1.5 billion people suffer from chronic pain. According to the NIH, the annual cost of pain management is estimated to be over $650 billion and exceeds the cost of heart disease, cancer, and diabetes. This is why I am so excited to present today's podcast to you. The ideas and work we present emerge as a forerunner for solutions for chronic and acute pain, acute injury, and accelerated healing. Our success rate with neuromuscular dysfunction in our clinic is well above 90%. In this episode, we talk with Dr. Craig Buhler, my trusted friend and mentor with a heart of gold, who has worked persistently and consistently with results considered impossible for over 40 years at the highest level of sports performance. The work is incredible, and I'm fortunate enough to have studied with him and used this work in my own clinic. As we look towards the future of healthcare, a future that empowers individuals, prevents chronic illness and pain, the AMIT method is top in my quiver of tools to have access to a healthy, active, high-energy lifestyle. This method clears pain, predicts and prevents injury, and allows people to achieve their full human potential. When I hear podcasts, including Huberman, claim that pain can only be managed and treated with NSAIDs, pharmaceuticals, surgeries, nerve blockers, and cortisol injections, it just simply isn't true. There are real solutions that surpass these suggestions. The human body is meant to move, and the AMIT method gives that gift of pain-free, fluid, strong, and stable movement that gets better over time. This method allows the human body to achieve results beyond what was previously thought to be possible. Please enjoy our episode with myself, Christina Walecka, and Dr. Craig Buhler.
Welcome back to Centered Presents The Future of Health. I'm Christina Walecka.
And I'm Dr. Molly Brown.
And today we are lucky enough to be joined by Dr. Craig Buhler, who is a chiropractic physician. He's been practicing for 50 years. He was the chiropractor for the Utah Jazz for 20 years. He's worked on anyone from the U.S. ski team to NFL players, and he is the founder, developer, and creator of the Advanced Muscular Integration Technique method.
Dr. Buhler is a brilliant doctor and has become a trusted friend and mentor for me, and we're super excited to have him. So we have a lineup of questions to ask him, and we'll be talking about many things, including the future of health and healthcare and where we're going.
It's my pleasure to be here.
Welcome, Dr. Buhler. Nice to see you.
Thank you. Just don't ask me any really hard questions.
So I guess to go ahead and get started, can you share with us the Advanced Muscular Integration Technique method?
Okay, well, I didn't develop it initially. It was a Dr. Alan Beardall from Lake Oswego, Oregon. And when I was going to chiropractic college, I met him and we developed a friendship, and I was allowed to come out and observe once in a while, as a student. And then between my junior and senior year, I worked full time with him while he was developing the work. So I got a great education outside the 4-year chiropractic curriculum. And I continued to take seminars from him. And then about 48 years ago, he and his wife were killed in an auto accident in England. So I've just continued to work with it and expand on it and develop it through my career. It's changed the course of my career because of how effective it is. When a muscle is injured, you overload its integrity. One or two things happen. You either tear the muscle and or the central nervous system inhibits the muscle to protect it, just like a circuit breaker. It does that to protect it while it heals. So the body adapts in the muscles next to it to take the load off the muscles injured. Well, because those pathways of the injured muscle become less used, they become dormant. And the muscles you've adapted to become your primary motor pathways back to the prefrontal cortex of the brain. And even though the muscle's healed, those pathways are still dormant. So the problem is we go from one injury to adaptation. That adaptation muscle can become the next site of injury. Then we go through another adaptation. We accumulate those injuries, adaptations in the body to where we get to the point there's nothing left to adapt with. We end up with chronic pain. Those imbalances remain for a lifetime. And the way I know that is because as people get older, the old football injury they had in high school begins to display.
Right.
So if it healed, how come that old injury comes back? And the answer to that is because those muscles had become inhibited and never reactivated. And that's what makes the Advanced Muscular Integration Technique a game changer, because we can define where those muscles are, and then the therapy we've developed by integrating all these different disciplines flips the switches back on, and you go from a muscle that might be able to handle 12 pounds of force for half a second, and you activate that muscle, it's 40 pounds of force. They can hold it for a full 3 to 4 seconds without giving way, and the pain's gone.
Which is why I love using this technique, especially for youth sports, because if you take a talented and disciplined athlete and they have a minor acute injury, typically that would put an athlete out for a whole season. And with this method, we can get them back the next day. There's no missed days. It's a complete game changer, and they can get right back on the field and right back on the ski race, and no missed days, better than ever. And so there's no time lost for injury. It's really mind-blowing.
So if you wouldn't mind sharing with us, what kind of sets the AMIT method apart from other techniques in this field?
Everything. The reason Dr. Beardall developed the technique was because he was a nationally ranked distance runner. In fact, he actually worked with the two guys that started Nike. When they were first developing their shoe, they developed it in a garage, and they were all runners, and Alan would help them with kind of design, and he had a pretty good connection with the athletic community in Oregon. But he found that he would treat athletes and they'd be fine on the table, but then when they go out and start competing, they'd break down again. And he said, why don't they hold? And that's what motivated him to start digging deeper. And I remember I was in his clinic observing, and there was a basketball player from the Trailblazers that he was working with that had medial knee pain. And he came back in and said, my knee still hurts. And so Alan says, well, show me the position that you're in when you feel the pain. So he got off the table and he went into a slight squat and rotated, and it elicited a pain. So he had him lay back on the table and put his leg in that position and muscle tested through that plane of motion. And he had no control. And it created the pain that he experienced. And Alan thought, well, what muscle's responsible for that? Because he had worked on the quadriceps, and they were solid, but it was an isolated position. So we went to the dissection lab at Western States Chiropractic College, and we started looking more closely at the quadricep muscles. And we noted that there were some fascial planes, and as we dissected those out, we exposed 3 primary compartments. And that's when he got on the idea that there are divisions to the quadriceps. So through the course of the next few years, he developed muscle testing for those isolated divisions. So he basically expanded the field of anatomy. So there are actually 13 muscles that make up the quadricep complex. He defined 4 of vastus medialis and 4 of the vastus lateralis, 2 divisions to rectus femoris, and 2 divisions to the vastus intermedius, plus a little muscle called articularis genu. And then years later, I discovered the 4th division, which is the oblique. And I posed that question to Mark Nelson, who was a head anatomist at the University of Utah Anatomy Department. Most people just blow me off, but he said, you know what, I've never thought about that. Let's go look. So we went into the dissection lab. They pull out a specimen, and their head dissector, Sean, we just kind of looked at it more closely, and they did the same thing. We found these fascial planes, and we dissected those out. We found 4 separate muscles. And Sean said, I wonder if they have their own nerve supply. They traced the nerve chain, and sure enough, each of those muscles had nerves penetrating the belly of the muscle, which indicates a separate muscle. And they were blown away. It's like, this is so exciting.
And it is so exciting because when someone comes in and they have muscular pain or neuromuscular pain, we, with using this advanced muscular integration technique, can get very precisely right to the root of pain quickly.
Exactly.
Activate the muscle and clear it.
Exactly. And then what's fascinating, they say, well, they've been studying anatomy for hundreds of years, right? There's nothing new in anatomy. Well, Mark sent me an email 3 years later. He said, I thought you'd be interested in this. Forget which university, they discovered a new muscle. They called it the tensor of the vastus lateralis. And it's actually the upper division of the vastus lateralis that Beardall defined years ago.
Amazing.
And they were all excited about that. But it validated the fact that there are divisions. But if you look back at the early editions of Gray's Anatomy, the muscles were divided. But over the years, new editors came on board and they decided to simplify it for the students. So they removed the divisions, which made it easier to learn anatomy, but you lost a functional element of the anatomy.
Especially when dealing with elite high-performance athletes, this work is very precise.
Precise, and that makes it unique. Beardall started looking at different systems as he developed the work. And the criteria was, what do we need to do to turn a muscle back on? Because we had elite athletes, great shape, and he would isolate different divisions, and they flat couldn't control it.
Really quickly, you mentioned earlier muscle testing. Can you explain that for those who don't know what it is?
Yes, we approximate the origin and insertion of the muscle, and then we push against it. We find that there's a difference between strength testing and testing the neurological control of a muscle, which is basically proprioceptive control, which is a fine motor coordination of muscles. And when a muscle's injured beyond a certain point, those pathways are inhibited to protect the muscle while it heals. So we isolate each muscle through its plane of motion, not for strength, but just that neurological control. We find that even the best athletes, there are certain muscles that it's like the switch is off, which shocks them. It's like, wait a minute, I can bench 400 pounds, and yet I can't hold more than 12 pounds through that plane of motion unless you allow them to recruit other muscles. Then it's like pushing on a wall. You don't budge it, but you isolate them into that right position, they can't control it. So Beardall started looking at different systems in the alternative healthcare world, lymphatic points, vascular points, organ-gland relationships. There's thousands of reflex points on the outside of the body that reflect internal functions. So the gallbladder, the pancreas, all these organs have specific reflexes that if those organs are stressed, become painful. So you can be washing your hair and hit a spot on your scalp that's painful, but you don't remember hitting your head. That's a reflex point to some system in your body that's overloaded. The body demonstrates glandular organ tissue stress years before you develop a disease. So then he started integrating those, and he found that there was a certain point, like on the skull, that when he touched, a muscle got strong. When he took the finger off the point, the muscle went weak again. So he knew there was a relationship there, and it's like, whoa, what does this mean? I mean, it's like you stumble onto these discoveries. You don't necessarily know how it works. You just know there's a relationship here.
So basically, you're isolating a muscle, and when that muscle is isolated, you can, if it's weak, that muscle is shut off and not working the way it's supposed to. And when it's strong and you can feel the force, it's like, okay, that muscle is working correcally.
But there's a difference between weak muscle and inhibited muscle.
Okay.
Because there's two different phenomena. One's basically condition based, and the other one's neurological based. That's what makes this uniquely different. And then they started experimenting with acupuncture points. And Alan found that there were actually fractional acupuncture points, because he would trace a meridian, and he would check different points, but when he went between points, he found that there was a point on that meridian that strengthened the muscle. And then he realized there's fractional acupuncture points. So it's like he expanded the understanding of acupuncture. When he added the acupuncture component, everything changed. There's not an acute injury that we can't solve in a short period of time. And when we treat the muscle, it holds. Unless there's something deeper, if there's some type of pathology, the muscle won't hold. It's the body. The body's really fascinating, because it won't let you off the hook until you've solved the equation.
Yeah.
It's like the body says, well, thank you, and you missed it. So it allows us to be very precise in our diagnostics, because if there's a tear, that muscle won't hold, because the muscle's pulling on a tear, and as soon as you stress that tear, the proprioceptive nervous system inhibits it to protect. Just like if you're walking outside barefooted and you step on a rock, you don't think about it. You automatically react by unloading, and then you think, oh, what did I step on? Because it hurt. So there are basic primitive reflexes based on survival, and we use those reflexes as part of the diagnostics and the functional analysis of the human body.
I think one of the most powerful things about the AMIT work is that it was developed by someone who was always inquisitive and always searching for more systems and open-minded in the correction. And that's the approach that led to this brilliant system that then you, thank goodness, had the good fortune to carry on to other people. And also that, it can be brilliant combined with other neurologically based work as well. So,
Exactly.
and he, to my understanding, had other systems, correct, that he had worked out.
Right.
Yeah.
But the thing that's so critical and has really been the source of all innovation is integration of the best of the systems. And when you try to isolate with just a certain type of care, you're missing so much. What's exciting now is the field of proprioceptive neurology is evolved to where it's explaining why this works.
So a lot of people suffering with pain or injury will instantly probably go to a doctor or use some sort of ibuprofen or medicine to deal with the pain they're suffering, maybe more internally, or surgery if that's what the doctor recommends. You're saying those aren't necessarily the paths you have to take.
Exactly. There's a time and a place for medical care. They've made incredible advances in surgical repair of injuries. I mean, I remember when I was in high school, we had a friend of mine that tore his ACL playing football for the high school. They replaced the ACL. They put him in a cast from his hip down to his ankle. He was in that cast for 8 weeks.
I've done the ACL. Haven't you done the ACL?
Yeah.
He never played sport again.
Yeah.
No.
They used to do the whole, cut down the
Oh
whole
yeah,
leg.
just a foot-long incision.
It's the whole leg.
It gives you a great opportunity to get a really cool tattoo. But no, and then now they make 4 little incisions.
Yeah.
They replace it. You're up that day. So why up that day? Because they found that the sooner you get mobile, the better the outcome.
Exactly.
When I was in high school, I was excited because I was able to put a cassette player in my trunk and I could play my music without listening to the radio. Now you can put thousands of cards on a little tiny credit card thing. If you go into the training room, you get the same treatment I did when I was in high school,
Right.
ice and stim. We've come so far in so many ways, yet we've stayed archaic in other ways when it comes to injury, therapy,
Rehabilitation.
and correction.
And an amazing thing about this advanced muscle integration technique method is that it combines 15 different systems of care. So it's such a comprehensive correction, including organ and glandular function and the acupuncture meridian. Can you talk a little bit about that, about how comprehensive the muscle correction is?
Well, as a chiropractic physician, we're trained in differential diagnosis, nutrition, lab diagnosis. If you have a glandular problem, you're going to run some labs. If there's a kidney problem, you've got to be able to handle that or refer it out depending upon the severity. So it's really degree of complexity. Is it something that will respond to conservative care, or is it something that requires medical intervention? And that's the integration system. I rarely get referrals from medical doctors, and yet I refer a lot of people out to some of the best, if not the best, providers in the area because I trust them. And they know when I refer a patient that it's a case that needs medical attention, so that we usually get them in right away. They don't have to wait 6-8 weeks before they get in to see a doctor. But the nutritional part, the rehabilitation part, there's just so many things that go into the mix. Once you turn the muscle back on, now what do you do to help a person rehab?
So it's really complementary with other systems.
Yes.
We need the physical therapists. We need the trainers, the high-level trainers. We need, a really high quality of nutrition. It doesn't take the place of anything. It just accelerates the whole healing.
Exactly.
Yeah.
So just to give you an example, Kevin Durant tore his Achilles tendon in the playoffs in 2019. And apparently he pulled his calf muscle 2 weeks before he tore the Achilles tendon. Commentators were talking about that, and their concern was that even at the highest level, we still don't have a firm understanding of load management, why elite athletes get injured, why and how. And Durant was out for 555 days before he started playing again.
I know, he was on my team. Go Warriors.
Okay. All right. So
I think you could have had him back a little quicker.
okay, well, then we get to talk about this will be great. Steve Nyman, I started working with him when he was 18. He was a national junior champion in the downhill. And when he came in, he had fractured his tibia, and he had a rod put in. And after a year, he still couldn't do one-legged squat.
Wow.
And he was ready to give up his sport.
Right.
So I did an evaluation, and I started treating him. I worked on him for an hour and a half. Well, I reactivated a bunch of muscles. He got off the table, did a one-legged squat without pain.
Amazing.
And it was like, I'm sold. He retired last year at 41.
Mm-hmm.
So from 18 to 41.
Amazing.
In 2011, in November, he when you're skiing 95 miles an hour down a sheet of ice, you crash, you're going to tear something. I don't care
You die.
how good the doctor is that's taking care of you. Anyway, he tore his Achilles tendon at the end of November. He had it surgically reattached. After 6 weeks, I started working with him, reactivating muscles, and I checked him every week through that process. By March, he was back on snow, and he won a World Cup that year in Val Gardena, Italy. That was about 105 days compared to 555 days.
That's what I feel like we see time and time again with this method.
And you've had similar cases in your practice as well.
Definitely. Athletes who are sitting out for the season and possibly looking to end their career, their performance skyrockets.
So looking at a case like Aaron Rodgers, who again was set up to take the Jets to the Super Bowl this year, and 1 week into the season, he suffers from an Achilles injury. Is that something that could have been prevented? Is that something that he could have come back from sooner?
I cringed when I saw that. It's like that injury could have been predicted, and it could have been prevented. Because he had a bunch of muscles in him, but I'll guarantee it, because I've seen that through my career. And unfortunately, so many athletes experience that same kind of thing. The beauty of the Advanced Muscular Integration Technique is we can predict injuries before they happen. And the work allows us to reactivate muscles so we prevent injuries. That's why the Jazz had such a low injury rate. We could predict when a player had an injury, we knew that if we didn't correct that, that would eventually lead to another injury.
Because under force, it couldn't sustain.
Exactly. Now, you think about Aaron Rodgers, he's great shape, conditioned to the top level. He ruptures an Achilles tendon. He had to be predisposed. And like they talked about load management with Kevin Durant, that could have been prevented too. Professional athletic teams have to start looking at this type of model.
It'll save them money.
I know.
So not only can we prevent injury with this work, if there's an injury that does happen, which does happen all the time, we can accelerate recovery, and we can also prevent future injury at the same time.
And you're working on these cases pre-surgery and post-surgery.
Mm-hmm.
John Stockton sustained an injury to his knee, and he damaged the cartilage. And he had a procedure called a microfracture surgery, where they go in and drill little holes to stimulate blood supply. So I worked in conjunction with the team physiotherapist. So we had a treadmill with a metal apparatus with a harness. So we could get him in the harness and offload him so he was maybe weight bearing 10% of his weight. So 6 weeks out from surgery, I balanced all the muscles. And so he started running on the treadmill at 10% of body weight. And then when he got through, I reevaluated him to see if everything held. Well, there was maybe 1 or 2 muscles that shut down, so I treated him again. The next day, same thing. And when he could hold, then we cranked it to 20% of body weight and had him run. And then I checked him again. I might find 1 or 2 or 3 muscles that shut down. And then I'd treat him, and the next day, the same thing. And each day may take 2 or 3 days before we could increase it to the next level. But we rehabbed him in 3 weeks.
That's amazing.
And
It's unheard of.
but to where he was running full throttle.
Wow.
Out 3 weeks out.
Oh, yeah.
Well, Bill Romanowski at the time was playing with the Broncos. That was the first year they won the Super Bowl, and he invited John and I to a game. We sat in Elway's box, and after the game, we went down to the locker room, and Dr. Stedman, who actually developed the microfracture surgery procedure, and they were talking, and Stedman had heard that John had the surgery, and he asked John how he was doing, and he said, "I'm doing great." He said, "I'm back playing," and Stedman looked at it and said, "Well, that's 6 weeks ago." And John said, "Yeah." He said, it takes a good 16 weeks to come back from that.
Amazing.
So when you activate the muscles so that when they're training at a certain level, they don't break down, their rehab accelerates. You don't allow them to train on a muscle or two that are inhibited, because that slows the process. My point is, athletes should get better as they age. The problem is because their bodies break down as they age, they get to the point where they just can't do it anymore. So, I was with the Jazz as their team chiropractor for 20 years, well, 24 really. I had access to players for 20 years before we got a new trainer in who managed everything medically. The last few years of my career, Stockton was the only player I was allowed to treat. We had the lowest injury rate of any team in the NBA for a 20-year period. We had seasons we only had 11 player miss game due to injury for the entire season. That's unheard of.
What is the current average?
Well, the average was 141.
Amazing.
But to have seasons when you only have 11 player miss games, the 2 years we went to playoffs against Chicago, we had 51 players, big games missed. So, guys get knee injuries, they get back injuries. If you go online and look up John Stockton's ankle sprain, it was during a road game. And when you see it, you'll cringe, because they had to help him off the court, which I'd never seen it happen before. When we went into the locker room, the trainer evaluated him. He was in so much pain, he was shaking. So I started working on him. I adjusted the ankle back in alignment, because when you sprain an ankle, you actually torque the talus, which is the top bone in the ankle. So when you're walking on a joint that's distorted. And so the joint capsule creates pain to protect you. And then I reactivated the lateral stabilizers to create stability. And the first few steps were painful, but after that he was running in the locker room. They taped him and he played the fourth quarter, and then he played the next night a full game on an ankle that had been severely sprained. That's unheard of medically. I took a lot of heat from the medical staff because I treated an acute ankle like that. But I did that thousands of times with the Jazz. We never had a player miss a game because of an ankle injury.
Well, I know too, through like my own experience with the work, both of you have advised after you perform the technique is like, get out there and move. Don't sit around, like get back to it.
Right, because once a muscle is neurologically engaged, the walking and the movement becomes therapeutic.
Yeah.
So it's
Exactly.
amazing.
You get better circulation. And what's really fascinating, recently the literature over the past 5 years has indicated that ice and anti-inflammatories should not be used for acute injuries.
Right.
Which is, they still do it. But the reason for that is, what's the purpose of inflammation? To heal.
To heal.
But see, if you realign the joints so it's tracking properly and reactivate the neurological control of a muscle so you're stable, then the more you work it, the better the outcome. It's a game changer.
It is.
For
it
sports
really
medicine.
Is. And we see it time and time again. And to my surprise, that most of the teenage athletes that come in that I work with, they say their whole team is on Tylenol or Advil or ibuprofen, and none of my athletes or none of my clients are on those types of things.
They even mentioned in the Humerman podcast about like just, I think he mentioned he takes Advil every day or
every day. And I was a little disappointed at that podcast because I listened to 3 hours of a podcast that millions of people listen to, and the majority of the podcast was talking about anti-inflammatory, opioids, surgery, which seems very remedial to me, considering with the Advanced Muscular Integration Technique and some of the other methods I use, I don't even consider those on a daily basis for chronic pain.
You have to wonder if it's like they only think they have those options. They don't know of any other options available.
A lot of times I hear on podcasts MDs and different types of MDs and neurologists and They're all from Stanford.
Care to name names?
And they're the top people, and all they talk about is the theoretical aspect of pain and theoretical solutions and opioids and painkillers. And I really want to emphasize, because a lot of times people come into my clinic and they don't believe that we have an instant fix to pain, and yet it happens every time and time again. The most common thing I get is people say, Molly, I didn't believe you when I first came in here. And I say, what? You didn't believe me? And it's just second nature for us. But really that we have an instant resolution, permanent solution, preventative solution to future pain. And can we just talk about that a little bit? This is the solution to pain, in my opinion.
Well, there's truth to that for sure. Mm-hmm. There's always a reason for pain. It's the body's protective alarm system. Mm-hmm. And when we take medication to suppress it, it's like telling the body to shut up. And all you do is cause the body to break down even more.
Right.
Because it's not fixing the problem. It's just like turning it off so you don't feel the pain.
Yeah.
Now,
we want to feel the pain, actually, right? To guide the process, if you have the solution.
Exactly. I have people coming in that have been in pain for years, mm-hmm. and they're depressed. They've tried everything under the sun. They spent thousands and thousands of dollars mm-hmm. out of pocket. Mm-hmm. Mm-hmm. And the problem with that is that medical doctors are looking for a pathological source of pain. Mm-hmm. But a large percentage of pain is not necessarily pathological. Mm-hmm. It's coming from other sources. Mm-hmm. And what I found is that the primary source of pain is where the muscle tendon attaches to the bone. Mm-hmm. And that attachment site is called the enthesis organ. And that's based on the work of some scientists at Cardiff University in England, Dr. McGonigal and Dr. Benjamin. And when we treat a muscle, part of the treatment is stimulating that enthesis, that attachment site. And by stimulating those points, it removes the pain. Now, my question has been, well, how do you turn off inflammation in just a few minutes? Mm-hmm. So I knew it wasn't an inflammatory process.
Right. Mm-hmm.
And I have the opportunity to dig down into the literature because my kids are going to college, and so I have access to Medline through the medical library. So I can go in, not just look at the abstract, I can get the whole study mm-hmm. and read it. And, at one point, like in 1997, they said that except for articular surfaces, all tissues were endowed with proprioceptors. And then they found a new type of staining, and when they used that staining, they found that the articular surfaces were loaded with proprioceptors, and so they cautioned surgeons to be careful right. of protecting those surfaces. Well, here about 5 or 6 years ago, there was a study that came out where scientists evaluated the enthesis attachment, and they found that there were absolutely no pain centers. And then I'm left with, okay, wait a minute. Then what's the source of pain? Mm-hmm. And it bugged me because I was like, wait a minute, I see the result. And then here a year ago, a new study came out, and what scientists evaluated was the tissue surrounding the attachment site. And they found that when that muscle tendon attachment, the enthesis, was injured, mm-hmm. it created a reaction that began to proliferate more vessels migrating into and more pain centers being created around the enthesis organ. And that's the source of pain. So when we stimulate that attachment site, that's what we're influencing. Mm-hmm. Now the question on my mind is, okay, something chemical has to be happening at that attachment site. And I'm just waiting to find some study that shows the type of chemical that occurs when there's an injury to mm-hmm. that. So there's, like, the field of neurology is catching up right. with what we're doing, and there's a lot of questions to remain to be answered. But
you did say, so people come in and like they have one problem and then that exposes another problem. It probably is a case by case basis, but are people coming in and they're 200 muscles deep, or what is the average you kind of work through before the person doesn't necessarily need to come back?
Well, it can vary between 30 muscles to 80 muscles. It depends on, I've had ex-football players come in. I mean, John Welborn played in the NFL for 9 years, and I can talk about this because he talks about it on his podcast all the time. But he was a wreck. When he came, he walked in, he waddled like a duck. He had no rotation in his hips at all. I think he had about 100 muscles shut down. I worked on him for a full week after hours. And when I got through, he went in the parking lot and jumped on the hood of his car. That's how much improvement. He walked normally after a week of care. So it's like a puzzle. You put the pieces of the puzzle together, and it reestablishes your function. Now
So you're saying by activating the muscles, you can get instant strength, flexibility, mobility,
Recovery,
Yes.
less pain.
Yeah.
now,
instant.
strength, that's relative.
Yeah.
Because if you're in bad shape, you're going to have an increase in
Right.
strength, but it's not going to be real impressive. But if you're a professional athlete and you're in great shape and you injure a muscle, yeah, you're going to see a dramatic change back to original strength. Again, there's nothing out there in the
Yeah.
medical field that can do that.
So really, we're actually working through a system that restores your sort of your body's blueprint or
Exactly.
your ultimate potential.
Yeah. And the body, even chronic muscle tension is your innate trying to tell you there's a problem.
Right.
We've seen people who have been abused as kids, and they have constant tension because
So you
of the,
see that stored in the body.
you do.
Yep.
That's where the
Because
trauma in the
subconsciously you're waiting for that next trauma, even though your
It's
adult
trapped in the
mind,
nervous system.
yeah,
Fight or
it's
flight.
stored in the nervous system. And once they start exposing that and healing that, that tension just goes. The other thing that makes this unique is we can predict where injury is going to occur.
Wow.
So I had a football coach from local university come in because a consultant that worked with him said, you see what Buhler's doing. So I said, I don't want to know anything about your injury history. I'm going to do my exam, and I'll tell you where you've been injured. So we can test about 640 muscles in the body for neurological integrity. I did the exam. I nailed every single injury it had through high school, college. And so knowing that, then what do you do about it? Well, the therapy we've developed actually allows us to turn those switches back on and reestablish function. I get really frustrated, and it's really the driving force behind why I keep going. Too many athletes have surgeries they don't need, and athletes have injuries that they could have avoided. The medical model has nothing to offer. Just to give credit to the Golden State Warriors and Stephen Kerr,
Yeah.
I understand at one point every player was given a test, and that was based on level of stress. And if they got a certain score, Stephen rested them, which really irritated the fans because the main players
Sitting
rested.
on the bench.
Why aren't they playing him? You know,
Yeah.
they pay all these high prices for tickets. They want to see their main players. But he did a really great job of decreasing the injury rates. Although, if he'd had this, Durant
Yeah.
wouldn't have tore his Achilles.
No.
And Clay Thompson did the Achilles and I think the ACL.
Yeah.
I guess my question though is would you recommend someone come get tested before they even have an injury?
Absolutely.
Yeah.
So I took care of BYU's basketball team for 4 years. Coach Rose found out about what I did, and he brought me in. And at the first of the season, I examined every player. I went through every muscle, and I had a blueprint of where they were unstable. That first year, I had 5 of the team members who bought in. The rest of them weren't interested. None of those 5 players missed a game because of an injury.
Amazing.
The next year, we had 8 players buy in, and none of them missed a game because of an injury. The third year, we had 10 or 12 bought in, and none of them missed a game. The last season, we had 100% buy-in. They didn't have one player miss a game because due to injury, except one player. He got angry at the coach and put his fist through the wall and broke his hand. But that wasn't a basketball injury. But to have that kind of
It's a mental
of an
injury.
effect on a college basketball team,
Yeah.
that's never happened.
Well, I mean, it blows me away the potential too for professional sports when you have these athletes that, you know, a simple sprained ankle in the NFL and hundreds of millions of dollars, and they're out for 6 weeks or a season, and then it turns into a future knee injury or hip injury. And so I mean, the potential of preventative care through this technique I think it's unlimited.
Well, and the reason the Jazz had such a low injury rate is that I evaluated them before every game. And if I found a problem, I fixed it. So they went into a game balanced. Mm-hmm. They never went into a game with accumulated imbalances. Mm-hmm.
How long does an evaluation take?
At that time, maybe 10 minutes.
Okay.
Now, if I do a full exam, it may take me 20.
Okay.
Mm-hmm. And I just want to point out, too, when the muscles are engaged, neuromuscular engagement, the proprioception increases. So the way you position your body in space improves. And so the stability and strength and the room for error of twisting an ankle or any type of, just fluke injury really comes down just with the increased proprioception.
Exactly.
Yeah.
In 1997, the NBA did a study. The doctor for the Trailblazers was the lead researcher. They looked at, was a longevity study. They wanted to find out what the issues were that caused players to retire. And the biggest thing was axial skeletal problems and jumper's knee, patellar tendonitis. Mm-hmm. And one of the things that they found in players who had patellar tendonitis is that they were restricted through internal hip rotation. They said it was an interesting finding, but they didn't know what to do with that. Well, the reason they had restriction through internal rotation is because the internal hip rotators were inhibited. And so the body won't let you go into a position that it can't stabilize. So the way the body protects that is by contracting and tightening the other muscles to compensate for that. And the reason that internal hip rotation is a problem is because it puts abnormal stress on the knee joint.
And so really wherever you see tight tissue or tight, like people always say, I just hunched over the computer and my neck is tight. Really what we're saying is that indicates an inhibited muscle that can be corrected and you can be in proper alignment.
Exactly. So that's how you can predict an injury. Mm-hmm. And once you reactivate the muscle, you remove the source of the potential injury. Biomechanically, they're balanced. But the best athletes are the most masterful at adapting around their imbalances. But they get to a point where they've just lost their ability to adapt, and then that's when they have a career-ending injury. And when you consider the amount of money that teams pay athletes, right, and they lose them to injuries, mm-hmm, and what the financial effect of that when your main players are out with injuries. When we were playing Houston, we were in the Western Conference Final. John Stockton set a hard pick on Charles Barkley, and Charles got ticked. So a few plays later, Charles slammed Stockton to the floor, and he landed on his butt hard. And the next morning, Stockton came down to breakfast, and he was bent forward. Yeah. I said, "What's wrong, Stock?" He said, "Bules, my back's killing me. I got pain shooting down my leg." Well, that's a disc injury. And we're tied in that series, and we're playing the next night. And I'm thinking, that's a serious thing because you don't recover from a disc injury in a few days. So I worked on him for an hour and a half that day, and the next morning he was still in pain. I worked on him for another half hour, and I said, "Stock, this is going to take time." And he said, "Buhler, you can do this." I said, "Okay." So worked on him for another half hour, and when I got through, he got off the table completely pain-free. Amazing. And he played that night, and that's the night he shot that final buzzer beater that took us into the playoffs against Chicago. Now, if it hadn't been for this work, it would have been a different story.
Well, it's also amazing that these athletes are performing with inhibited muscles, and they're still so much better than the rest of us. Like, imagine if they were fully at their unlimited potential, they would be godlike.
That's what I'm saying. If you take a talented and disciplined athlete who's interested in this type of work and preventative care, it is unlimited where you can go with that athlete. And I've seen it time and time again.
I know. And that's the sad thing. It's like when I ran track at the University of Utah, I was on scholarship and I ran the 440 and the mile relay. And I struggled with a pain in my left foot. And I did everything the trainers told me to do. And nothing helped. Mm-hmm. The doctor injected me with cortisone, and you just learn to work through the pain. But every time I tried to crank it to the next level, I'd break down. And I I was fast. And the WAC outdoor time trials that I ran my fastest race against the fastest heat. But when I finished, I was in so much pain, I could hardly walk. So I lost my scholarship, dropped out of the U, and 2 years later, I'd struggled with migraines my whole life. So I went to a chiropractor. And I'd always been afraid of chiropractors because what my medical doctor told me about them. But this friend of mine said, well, my chiropractor is different. You ought to try it. So I went. And he did a great exam. He took x-rays and had me come back the next week for my report of findings. So he told me why I had headaches and outlined a care program for me. My first treatment, when I got off the table, anytime I was off my feet for even 5-10 minutes, the first few steps were painful. And I just learned to live with it. I hadn't even told him about the injury. Well, he asked me why I was limping.
Yeah.
And I said, well, it's an old track injury and nobody can help me. I just have to live with it. He said, well, get back on the table.
See, this is where I think a lot of our society, the world, we're living in a state of managing. And like, I think people need to know they don't need to be managing and think like this is the best it's going to get. There are solutions out there.
Exactly. So he laid me on the table, evaluated my foot. Oh, and I had gone to an orthopedic surgeon that was the surgeon for an ABA team. It was a new franchise that came to town for a year. They went debunked, but I told him about my injury. He took x-rays, examined me. He said, well, I really can't find anything wrong with you. And out of frustration, I said, I'm frustrated because I'd like to try to make an Olympic team one day, but every time I try to push the next level, I break down. He said, well, if you're that good, we could put screws and wires in your foot to stabilize the joint, and I think it would help you. And that was one of the motivators that said, okay, I'm done with this.
Right.
And I was more willing to go to a chiropractor. So after the chiropractor...
Do you think that would have completely ended your career?
Yeah.
Yeah.
Absolutely, no doubt.
And the long-term stress and pain.
Yeah.
So he adjusted my ankle and made this incredibly loud cracking, popping sound. And I thought, he's fractured my ankle. I'll never walk again. I should have listened to my medical doctor,
That's why people are scared of chiropractors.
I know. So I got off the table pain-free for the first time in 5 years. I said, what did you do? He said, at some point, you've sprained your ankle real bad, and the cuboid, which is a bone in your arch, had collapsed. So you were running on a collapsed arch. I just said it. And that's when I decided there's more to chiropractic than what I've been told. And then I started looking more closely at the education, and I found it was equivalent to medical school. In the first 2 years after that, there was differences in the curriculum. And I was pretty much led to go to school and do what we do. But I can't tell you, I've had patients come in. I had a female athlete that came in from Brigham Young University who had a condition called compartment syndrome. It's when the calf is so tight, circulation becomes restricted, and their only option is to go in and surgically release that pressure. And her parents came with her. I examined her. She had no muscles firing in her calf.
And so the tissue became really tight.
And she's playing, she's playing on the women's basketball team, and she'd play for maybe 5 minutes and have to sit out for 5 and then back in. And I said, this can be fixed. Well, they went back home, and the doctor for the team said, no, you need to do it now, because if you wait, you'll not only miss this season, you'll miss next season too, because it's a long recovery. So her parents were back and forth. Well, they finally decided to try it. I said, what do you have to lose? If we can't get this solved in a couple of weeks, then have the surgery, but let's see what we can do. So they said, okay. So I cleared all the muscles. She was back out on the court. She played the season. She played the next season. She ended up playing in Europe on a women's basketball team. She had a teammate that had the surgery, and her teammate never played basketball again.
Right.
Oh, that's so sad.
So those are the kind of examples of surgical procedures that are unnecessary that can be corrected with this work. And that's why I love it. I love seeing the spark come back in the athlete's eyes who've given up.
Right.
Or I can come back. It doesn't get any better than that.
It doesn't. And it's the most amazing thing in the world, right? To light up someone's life with happiness and joy, and that's an inspiration into the top performance to their ability. And that's the other thing we can also address too, is the role of anxiety and depression in an injured athlete that can't ever see their top performance.
Their dreams. Well, the five athletes that I went to the Vancouver Olympics with, they were all kids that were post-surgical, struggling, and ready to quit. And I got them balanced, and I actually went to the Olympics with them, and I treated them before their event. And Tora Bright, women's half-pipe snowboarder from Australia, won a gold medal. And she had 3 concussions in the pipe 8 weeks out from the Olympics. They had to help her off the pipe after that third concussion. When she came to me, she was 3 weeks post-injury. She couldn't stand on one leg without falling over. We do a procedure called cranial nasal specific. And it's a cranial manipulation, and it's deep and it's powerful. I treated her 3 times that week, and at the end of the week, she could stand on one leg, balanced with her eyes closed. I treated her up every week up to the day before her event, and she won a gold medal in women's halfpipe, which requires impeccable balance.
Amazing.
Shannon Barkey, women mogul. She was struggling with post-ACL replacement surgery. She's 1.5 years. We're 3 months out from trials. And so I treated her, got her balanced. She made the final place on the Olympic team, and she won a bronze.
Amazing.
The 3 others, Steve Nyman, Ellie Okowitz, and Travis Janer, they didn't medal, but they competed at a high level, and they were ready to quit before we worked with them. So those are some of the stories of athletes that have given up. But I love working with active people and their families, and kids playing soccer, especially kids with concussions. Yeah. Personality changes, the cranial work completely changes their life. There's just some really cool treatments that we use that's outside the medical model, and yet it seems like we're met with violent opposition because it goes against the medical model. The pharmaceutical companies that control everything. If it's not a drug or a surgical procedure, then it's not paid for. It's not considered standard of care, and we're going down the wrong path.
Which is why I think that it's such an amazing opportunity right now, where people are open to different methods and prevention and alternative care of all sorts. I think actually it's a really amazing opportunity at this time to have people be really open to this level of work.
I know. I don't think I've ever seen a time where people were more willing to look outside the medical box. We've been frustrated with the vaccine fiasco. We're tired of the drugs and surgery. We're not getting healthier. We spend more on this country than any country in the world, and yet we're ranked 32nd of quality of health. It's our diet, lifestyle. It's a drug culture with everything.
Glyphosate, the toxins, people go and travel in different countries and they feel immediately better after 3 to 5 days.
I know. We just got back from Europe, and it's a whole different.
Yeah, you feel better, right? You feel good.
Well, C. Everett Koop, the past Surgeon General of the United States years ago in a speech, said that 85% of the healthcare problems in this country are a direct result of dietary deficiencies and abuses.
And I do think that people are really ready to take charge of their health and to take control of what they can so that they can be their best. I don't think there's any alternative at this point, because we have 80% of Americans on antidepressants, and it just seems ridiculous in the United States to have this level of care. And there are so many solutions out there that require consciousness and, a willingness to be open to other ideas.
The next question is, how do you see the future of healthcare changing with the current structure clearly crumbling? And where would you seek out and actually find somebody qualified to do this kind of work?
That's a great question. I just happen to have an answer. Okay, so there's a company, it's called Alternative Medicine Incorporated, AMI.
Alternative Medicine Incorporated.
And they started in 1997. Now, this is an old study. But they had 700,000 covered lives in a Blue Cross Blue Shield model in Illinois. And the program was set up to where those 700,000 people had the opportunity to select a chiropractic physician as their primary care physician. And it was fully paid for. And they did analysis of each patient and stratified them. People who had high risk, they would refer to a medical doctor for the intervention, but everybody else was treated chiropractically. And after 2 years, this is the result. This is amazing. A 56% decrease in prescription utilization, an 80% decrease in hospitalizations,
80% in hospital.
86% decrease in outpatient surgical procedures, and an overall 66% decrease in total healthcare costs.
And you could imagine the total cost that would save medical establishment and people.
And then my father-in-law was a chiropractic orthopedist. He lectured all over the world, and he was at one point the president of the American Chiropractic Association. And he went to a meeting of insurance people, and the head of the Blue Cross Blue Shield region spoke, and he talked about this study. And the conclusion, he said, frankly, we don't know what to do with that data. Well, doesn't that seem interesting? We don't know what to do with that data. Because think about the impact that would have on hospital revenue and drug revenues. It reveals the machine that runs the healthcare here. So nothing really came of that.
Yeah.
Now there's a company called Own My Health that I'm involved with. They're a corporate wellness management company. They're unique across the board.
Own My Health?
Own My Health. Okay. And they go into a company and they do labs and they stratify people as far as risk factors. And each level is required to participate in certain things, certain exercises, certain nutritional changes. They have 24/7 access to a registered nurse practitioner, medical doctor. And so if you have a question about an issue, instead of going to the ER, you just call and you talk to a professional, and they help talk you through. And they have to score a certain number of points to stay in the system. If they don't, then they're kicked back in the regular insurance model, and their premiums go up. So it really incentivizes people to be more accountable. That's the problem with healthcare. Nobody wants to be accountable. Everybody relies on the doctor to fix them with a pill or surgery. And that's producing the results we're getting. So when people are incentivized and they have skin in the game, they're more willing to participate. So this is what they accomplished after 4 years. In 4 years, all 3 risk categories, total cholesterol and risk factors, were reduced. So this is the percentages. Smoking decreased by 75%.
Amazing.
Respiratory conditions by 69%. Digestive problems by 65%. Circulatory, 79%. Nervous conditions, 73%. Muscular, 77%. Skin conditions, 67%.
That's amazing. I think we need to create a culture of wellness and health is what we need. People's consciousness around health to change and be incentivized personally, which is just a complete change in consciousness. We just have to have people inspiring others to how amazing it is to be healthy and to feel good and to feel your best and how much your quality of life improves.
Well, one thing you mentioned that I kind of want to touch back on is you started with you had migraines, and we talked a lot about like pain and rehabilitation. But in terms of being in brain-based wellness, like trauma being stored in the body, it sounds like this goes far beyond just like the athlete. Like how does this work really help maybe someone struggling with the depression or the anxiety?
Well, when you have a head injury, you affect the cranial structure. And it can affect the pituitary gland. It can affect cerebral spinal fluid flow. It's really involved with what's considered post-concussion syndrome. And it's accumulative. So we insert a small balloon the size of your little finger attached to a sphygmal bulb into the nasal passage and inflate it and release it. By pressurizing inside the skull, it unlocks that mechanism, and people actually feel the sutures pop.
What does that feel like?
Well, it's an unusual experience. I've done babies who couldn't nurse because they couldn't breathe because of birth trauma. They're like a different kid. Kids with post-concussion syndrome, their personality is different. They can't focus more than an hour. They're not going to school. Migraines. We do 1 or 2 treatments, and their personality comes back. They're back in school. It's a miraculous treatment. Sleep apnea, seizures. I mean, you go down the list. And I learned that in chiropractic school. But the depression, it can lead to depression. But the other thing is when people struggle with pain and they realize they're not getting better, that's depression. But then the importance of gut flora, because most of your brain chemistry is formed in your gut through bacterial digestion, and you can treat that with medications, but why not go to the source? And most people's gut flora is messed up because of all the antibiotics in our food supply. There's so many things, and that the beauty of the Own My Health program is they have a coach that goes through their findings and then outlines a program for them and will direct them to the right provider who can help them reverse that process. And not much of it goes to the medical profession unless they've moved into a functional medicine approach. If a medical doctor, and I've been to nutritional seminars, and at lunch I'll be sitting across the table from some people who are medical doctors, and I'll say, what motivated you to come to a nutritional seminar? And they always say, because I got frustrated because my patients weren't getting better. I said, what have you found since you've integrated nutritional therapy? Well, my patients are getting better. What do your colleagues think of that? Well, they think we're quacks. Think about that. It's like we're getting our patients better using nutritional intervention, but it's not the medical drug approach, and so you lose credibility.
So not only do we have to have healthy doctors who have holistic approaches, we have to have people who desire that and want that level of health and all the benefits to life that it brings.
More and more people are looking for options outside the box. They're looking more organic. I think one of the greatest threats to our health is the Roundup, the genetically modified foods, and the effect that glyphosate's having on our digestive system. It's raising havoc. That's why we've got this epidemic of autoimmune diseases, because the gut membranes become damaged and you lose that protective mechanism. So you're getting things in your blood system that shouldn't be there, and then your immune system attacks them. And if your thyroid takes those elements up, then your immune system attacks your own thyroid, which causes Hashimoto's disease. Why would your immune system attack your own thyroid or your own pancreas? Or it's crazy. There has to be something different in today's world that didn't exist 50 years ago.
Unprecedented toxicity, which also under these times of great pressure is such an opportunity for transformation. And that's, again, why I think it's such a time of change for healthcare and the future of healthcare and different systems that are emerging. But we just have to see that people really want to shift from, being a treated victim to an empowered, conscious person who seeks the highest level of vitality and health that's available to them.
Yeah, and what people need to understand is that everything in medicine is based on standard of care. Well, who sets the standard of care? The pharmaceutical industry.
Right.
Okay.
So anything outside that is considered irrelevant. But we're in an era of disruptive innovation, and things have to shift from the standard of care to results-based, evidence-based care. So I can turn 80% of frozen shoulders syndromes around with one adjustment. It's a very precise adjustment. Frozen shoulder syndrome, they don't know what causes it. People wake up one morning, they can't lift their arm more than 90 degrees. It's painful. Physical therapy helps a little, but it can last between 6 months and a year and a half.
Or longer.
And most of it will spontaneously resolve itself. 20% of patients go to surgery. One adjustment, because we understand the cause of frozen shoulder And once we correct it, people go from not being able to lift their arm to lifting their arm, full range of motion and no pain. There's so many things in the alternative world that could make such a difference in our healthcare system.
It saves so much time and quality of life.
Exactly.
And money.
So you think your one takeaway for anyone would be just look beyond the traditional standard of care?
Exactly.
And I think that's also like something really worth talking about, because I know when I discovered this method and this work, it felt like to me that it was something I would have looked my entire life that I wanted to find that I just found. And I had all sorts of questions, and it made so much sense to me. It was more like a recognition, like almost a soul recognition. And do you want to talk a little bit about the role that intuition and the spirit plays in your own health and healing?
Now you get into an area that really, I think, is hard for people to embrace.
Right.
But there's an innate intelligence that resides in every human being. Who created your body? You had the sperm and egg merge and single cell, and that cell divided, and it created your brain. And then you had the primitive streak that formed your spinal cord, and then you differentiated segments called somites. And it was this amazing creative process. It wasn't a doctor there with a checklist. Well, okay, we'll do this now. No. And when you were ready, you were born. That intelligence is running billions, trillions of reactions in your body that science struggles to understand. And when there's a problem, that innate tries to communicate with your ego. There's a problem. But we've been conditioned from the time we're little kids for fast relief of pain, take this. So when the body or the innate tries to expose a system that's under stress through these subtle signs and symptoms, we just suppress it with a medication. We're basically saying, shut up. So it's like the fire alarm comes in your house and you just jerk the alarm out of the ceiling and throw it in the garbage can, problem solved. And then when the house burns down, you've got a crisis. And that's why healthcare today is about managing crisis, disease management and crisis intervention. The thing about this work, the Advanced Muscular Integration Technique, it embraces that concept. And the fascinating thing is that as we work with a patient, we start treatment. We'll clear a couple of muscles, and it's like the body says, thank you very much. Now fix this.
Yep.
And the next problem surfaces. So as we go through the therapy process, the symptoms move from place to place to place. And it moves from one area and exposes another area of injury that they've had sometime in their life. The old naturopaths called it retracing. So it's like the innate finally says, somebody's listening, and it goes into the show and tell mode, and it's a fascinating process to watch. Just like that football coach. I exposed the injuries he'd had years ago. And people think they're becoming a hypochondriac. They say, I came in with back pain. Now my shoulder's killing me. What did you do to me? Well, I just exposed something you've had there for years. And once we solve it, their pain's gone. You test a muscle, and it's weak, aberrant. And when you challenge it, you create pain where the muscle attaches to the bone. And then you treat it in 7 to 10 minutes, and you go back and test it. It's rock solid strong and no pain. And we have a muscle tester that measures force application against time. And we can measure the force changes pre and post treatment.
So you get objective data.
Exactly.
Yeah.
Well, if you say, well, you have a bursitis, capsulitis, tendonitis, well, you don't turn tendonitis, capsulitis, bursitis off in 7 minutes. So the pain's not inflammatory. It's neurologically based protective mechanism. And once you reset that circuit, solid. And I've seen, it's like
instant pain relief.
Right. So I had a patient, a snowboarder, Olympic snowboarder, who crashed and injured her hip. She came in, and I do a range of motion analysis. I lay on her stomach, and I asked her to lift her leg off the table. She could only go about 10 degrees, and it elicited her pain. All I did was clear the glute max muscles. I measured her before I treated her. She got about 12 pounds of force before it gave way. After I treated her, I applied 70 pounds of force. She could hold it for a full 3 to 4 seconds without any pain.
70 pounds.
70
And that's
pounds in
instant.
7 minutes. But she was in great shape. All
You
I
just
did
had
is,
to make the neurological connection to the muscle.
right.
Yeah.
That's all I did was just reactivate that back to the prefrontal cortex, and she was solid.
So I think one thing that's definitely missing from traditional or standardized medical care is the aspect of creativity in the healing process and the creativity in the human spirit.
Correct. All innovation takes place at that intuitive, spiritual level. People all have an aha experience. They're inspired by something, and they have an idea, and then they challenge the idea and see where it leads them. And that oftentimes leads them down into the rabbit hole. And, but that's the pure essence of discovery.
Yeah.
And
innovation.
yeah, but you're out of your head. You're in the moment. You're not just in your head trying to figure stuff out. It's like you have those moments of tranquility where you're just kind of meditating, and all of a sudden the idea comes to you, and you change the course of history.
And in that flow, and I feel like, this work and other work, really anything that gets you in a creative state of flow for healing or intuition or intelligence is really what we're aiming for. And the more tools we can supply for the body, the brain, the human spirit, that's where the healing occurs.
The better off people will
Exactly,
be.
because it takes place at a spiritual level.
Yeah.
And when you work with a patient, there's an intuitive process that goes on.
Oh, yeah.
I mean, I have doctors come and observe in my office, doctors that I'm training, and I'll be working with a patient, and I'll get this intuitive hit,
Right.
and I'll move to that, and they'll say, "Why did you go there?" I don't know. I just had a sense.
That's why you're so brilliant.
But the
It
body,
really is.
but the body leads you there.
Yeah.
And it's really a beautiful dance between the patient and the physician.
Yeah.
And medicine's lost that, and that's unfortunate. And I think the best doctors are the most intuitive, the most skilled, because there's an intellectual part, and then there's a sensory art part of the mix. And that's why when you integrate the best of the worlds, you just have such a neat experience with patients.
A miraculous experience.
But the ego has to be put on in a dungeon because the ego destroys everything. The arrogance. And I think professionals hide their lack of confidence with arrogance.
Well, I remember one time you said that if you're not seeing miracles in your practice every day, you're doing something wrong.
Yeah.
And that's definitely what we go for.
Yes.
We see miracles every single day, and they're possible, and we see them, and it completely changes people's whole trajectory of their entire life. What greater gift could you give somebody?
And
Exactly.
as the client, like I think, again, listening to that gut instinct, that intuition that we're all born with, but as we get older and we go to doctors and physicians and whoever it may be, we want to try to just believe them because we're told they're the professionals, but we also have to look at ourselves and be like, no, I have a gut instinct that maybe this isn't it, or there's an alternative way to think.
Or that you play an equal role in the
Yeah.
healing process.
When I
it's
was
your
in
body.
school going through my
You know best.
when I was in school going through my pediatric training, our professor was an old-time chiropractor, and he said, "This is a golden rule. You trust a mom's instinct with their kids." And what's that? That's intuition.
And love.
And that has paid off huge dividends for my career.
Amazing.
And it always bugs me when a mom comes in with a problem with her kid. And so the pediatrician, I told them what I was thinking, and they blew me off. Moms are intuitive, and you absolutely trust that instinct. And it's a good rule.
A mother's
to live by.
intuition, the best.
And love.
And love, the remedy, the cure for it all. Well, Dr. Buhler, this has been wonderful. I'd kind of like to wrap it up by asking you, is there any specific case that you feel like you must share, or a case that you haven't worked on that's out there that you're like, these are the type of people that could use it, or you're just itching to get to?
Every time I hear a report of an athlete getting hurt, in the pro sports, it's like that could have been prevented. It could be fixed. But there is a case that was really earth-shattering. I had a mom bring a little boy, and his name's Will, 7 years old. And Will was born with a form of muscular dystrophy. He had a hard time walking. He had only been able to speak single words. He'd never constructed a full sentence. He had a problem with the nerve control to his throat, so he had a hard time swallowing, and he kept aspirating. And he was in and out of primary children's hospital. They had his mom use a thickener so that it would help him swallow past his trachea. And he'd been to all kinds of neurological clinics. And every year they would do a swallow test. And at age 7, they did a swallow test, and the surgeon or this medical doctor said, well, this is as good as it's going to get. Somebody told him about the cranial work that we do. So she brought him in, guiding him in, helped get him on the table because he couldn't get on the table by himself. And I did the cranial on him. And he got off the table, and he and his mom went out in the waiting room to make a follow-up appointment. And he looked up at his mom and said, Mom, why did that man put that balloon in my nose? And she freaked. It was the first time in 7 years he had constructed a full sentence.
Wow.
Oh, wow.
They came in 2 weeks later for follow-up. I have these stools that swivel. He was on the stool swiveling on it. She said he's never had coordination to do that before.
Yeah.
Wow.
So I've treated him over the course of a year. He's probably received 12 treatments. And this winter he went skiing with his family.
Wow.
Now that's a miracle.
That's a
It's
miracle.
a miracle.
And that's just one technique that we use that creates miracles on a regular basis. It's not an easy procedure to have done too. It's kind of freaky. But people get off the table, and a lot of times they start crying because they've stored physical trauma in their head, and it releases. It just, and it's gone.
And their whole human potential of their entire life is released.
Yeah, and Tora Bright wouldn't have a gold medal if it weren't for that treatment. And I go on and on about miracles we've seen in people's lives, from coma to concussion to it's just fun doing what we do.
Yeah, changing lives.
And I wish more people were doing it.
And realize that there are actually practical solutions out there.
Yes. Yeah.
Well, Dr. Buhler, where can people find you if they want to learn more, get in touch, come see you for themselves?
Well, they can go on my website at amitmethod.com.
Okay.
And there's information on there. There's some videos on there. And call. I'm more than happy to talk to people on a phone call. So
Amazing. Well, thank you so much for coming and being part of this. We really appreciate it.
Well, thank you. It's my pleasure. This has been fun.
Thank you so much.
Yeah.
We'll see you again soon.
All right.
Hopefully we'll have you back
Okay.
with more extraordinary cases being solved. Thank you for joining us on today's episode of Centered Presents The Future of Health. If you're interested in learning more, please visit us at drmollybrown.com or email us at media@drmollybrown.com.